Meghan McCain, who is a co-host on The View, talked about healthcare, talked about Medicare-For-All, talked about Canadian healthcare, and just every single thing she said was wrong. So I'm going to play this clip, and when I first watched this clip, I got very angry. So I'm happy that I've calmed down a little bit, and I can address all of her ridiculous points point by point. So first, let's just play out this clip, and if you haven't seen this yet, brace yourself.
Everybody wants health care for, everyone, if we had the means to in every way. And by the way, discussing socialism on this show triggers everybody in the world, me being against it. I mean, having our heated discussion that we had last week, I get that there are people in this country that are for it. I'm 100% against it. And until, like Bernie Sanders says, Medicare-For-All plan would cost $32.6 trillion over 10 years, according to George Mason Center. And I just believe that at a certain point, if you want this platform, that's fine. Explain how we're going to pay for it. And if everyone who's for it, you have to pay the 70% or 80% in taxes that they are proposing.
I don't know if you have everything right there, Megan. A lot of these countries have similar tax rates that we have, and they're able to do a lot of that.
Small European countries that in no way...
Canada has Medicare
in no
for
way.
all.
But
Canada
that's one part of her platform. What she just said, I mean,
say it
all
again.
of it is
Medicare for all, which I think most people do agree with.
Universal jobs. Do you believe that health care is a privilege of some sort, or is it a guarantee?
I believe that there's a reason why people in Canada come to this country to get better health care. In Arizona, where I'm from, we call them snowbirds because the quality is better, and no one can explain to me how the quality would ultimately suffer. Do I want people to, in this country, not be able to have health care when they're sick or, God forbid, get brain cancer? I'm the first person to admit my perspective on this exponentially shifted when my father got sick.
Yes.
That being said, no one can explain to me how we're going to be able to pay for it and the quality won't.
Can I tell you something?
I think it's a human right. I think health care is a human right.
I have friends that
we're having a debate. We're having a debate right now, and I think the problem with this is, don't paint me out to be, and it's very complicated on this show. I'm just trying to talk about the realities of what it's going to cost. It's not that my heart doesn't open. I just admitted on national television that my perspective changed after my father got sick. But don't sit here and say, I believe in all these ways, because it makes me seem compassionless, and I am not. I am realistic about what it costs.
Go ahead. Okay. What I'm feeling inside is just a ball of rage. And I'm going to try and contain it a little bit just so I can get out words. Because if I get too angry, I'm not going to be able to get out any words. So I have to explain everything that she said there that was wrong, which is pretty much everything. So let's just, before I even get to pushing back on some of these comments that Meghan McCain said, just look at the whole framing of the conversation. Anytime there's discussions around healthcare or housing or education, it's all about, well, how do we pay for that? We can't pay for that. It's too expensive. Why is that never the conversation around military spending or around tax cuts for the rich? Was Meghan McCain on here yelling about how are we going to pay for this military increase? How are we going to pay for these tax cuts for the rich? Was she doing the same thing about healthcare, about that shit? Of course not. Because she doesn't give a shit. She is compassionless. She is a rich fuck. She inherited $200 million. Her mom is a 100 millionaire. Meghan McCain is at the top of the 1%. She is extremely privileged and has no idea what most people deal with. So yes, Meghan McCain, you are compassionless. Now, let me get to some of this. Actually, I haven't even reached the first points yet. So here's the 40 Senate Democrats join GOP to send $717 billion military spending bill to Trump's desk. So look, this is an issue that both Democrats and Republicans are on the wrong side of. Yet, Meghan McCain, she could attack Democrats here. She could still be her partisan hack that she is and attack Democrats for supporting this. But she's not doing any of that, because she only cares about spending if it's actually going to help people. So yes, she is compassionless. Now, let me get to some of these quotes. Just, oh God. Okay. This one here. Medicare-For-All would cost $32.6 trillion over 10 years, according to the study that Bernie Sanders put out. Isn't it funny that Meghan McCain didn't mention that study, that libertarian, that conservative study, also shows that healthcare, that Medicare-For-All over 10 years would save $2 trillion. So yes, it would cost $32.6 trillion because you're moving the healthcare system from a private insurance-based system onto the federal government. So yes, it's going to cost the government more, but people are now paying through their taxes and not paying health insurance. So the individual actually saves money. They would be paying less through their taxes than they would on their healthcare premiums, the deductibles, all that bullshit that you have to deal with. None of that would be going on. It goes through your taxes. I, as a Canadian, already have this. I don't think at all about healthcare because it comes out of my taxes. I go to the doctor, I come home. I go to the hospital, come home. That's it. And I'll get to the other points that she made about that, but Jesus. Next quote here. Explain how you're going to pay for it. This is one of my favorite ones. Because Bernie's plan on how to pay for Medicare-For-All has been on his website for over 2 years. Since he was running for president, he put this up. Nobody bothers to actually look it up. You could easily Google Bernie Sanders Medicare-For-All, how to pay for it. This page comes up and it tells you exactly how Bernie's plans to pay for it. But they don't mention that. They pretend like no one's ever talked about how to pay for it. Even though, again, why is the conversation always about how to pay for it only when it comes to helping people? But still, if you want to know the details, they are there. You just don't bother doing the research because you don't actually care to find the answers. You just care to be partisan and protect your bullshit side that has been protecting this private insurance industry that is making money off sick people. Unbelievable. The amount of ignorance and just lack of empathy that these people have for anyone that isn't in their wealth bracket is unbelievable. Another quote here. You have to pay the 70% or 80% in taxes that they are proposed. That complete lie. Complete lie. I, as a Canadian, have universal health care. We don't pay 70% or 80% in taxes. She just made that up. Complete lie. And as I said already, Medicare-For-All would save $2 trillion over 10 years. You'd be paying less through your taxes each year than you are paying now to your health care, to your health insurance company. So, just, like, where does this number come from? 70%, 80% of taxes? Just make it up. Just make it up. And you're on a TV show every day. And the only reason you are there is because your mother is a 100 millionaire and your father is in politics, was a congressman, ran for president. That is the only reason. That is the only reason anybody knows who the fuck you are. You have no talent. You are uneducated. You don't know dick about anything. You're fucking stupid. Did I make that clear? Okay. There's more. Oh, there's more. People, this is a good one because I'm in Canada. People in Canada come to the U.S. for better health care. They're called snowbirds. She didn't even get the phrase right. Snowbirds is not referring to people that come down to the U.S. for health care. Those are retirees that come to the U.S. during the winter months in Canada to stay in a warmer climate. That's what snowbirds are. I have American friends, people that worked in a guy that worked in a restaurant in Texas who talked about the snowbirds that come down there. Those are Canadians that come to a warmer climate during the winter. Nothing at all to do with healthcare. Just makes up lies. It doesn't matter. No one's fact checking her. No one actually, I mean, to be fair to the other panelists, they didn't know what she was going to say. But, like, she could just make shit up and not get challenged whatsoever. Now, she was challenged somewhat by Joy, and she has been challenged in the past, but she wasn't really challenged here, and it was unfortunate. I don't think that's ever... So, oh yeah. Quote, Canadians go to the U.S. each year for better health care. Just not true. Now, there's this number that a lot of libertarians and conservatives enjoy quoting. 45,000 Canadians come to the U.S. each year for healthcare. Not true. Let me show you where that number actually comes from. The Fraser Institute, which, by the way, is a conservative think tank, report estimates that about 1% of Canadian patients who received treatment from a specialist in 2015 got that treatment outside of Canada. The report estimates that percentage translates into 45,619 Canadians, slightly lower when compared to the 52,513 who went abroad for medical treatments in 2014, but higher than the 41,838 in 2013. The report does not break down the numbers to determine how many Canadians went to the US for treatment, but just refers to those who have received treatment in another country. So this number, this fact that you often hear about Canadians going to the US, 45,000 Canadians a year go to the US for healthcare, it's just not true. That 45,000 number is Canadians going abroad. Some in the US, some in Europe, some other countries. So this isn't Canadians escaping our healthcare system. This is less than 1% of Canadians. Now, what does that tell you? A lot of these are wealthy people. People who can afford to go to other countries for a second opinion, for a special treatment that maybe is just offered in one or two countries. Or people that are maybe already traveling abroad and need healthcare. So this is not people in Canada escaping. And look, there's a whole article I'll link to below the video about Canadians getting angry at Meghan McCain about this because she just made this up. Just complete lie. Canadians are not coming to the US in droves for healthcare. It's just not happening. Now, let me also share this. So since Meghan McCain is so concerned about Canadians coming to America for healthcare, 1.4 million Americans will go abroad for medical care this year. Should you? So even in the US, where there is just fantastic healthcare. And look, I'm not even denying that. If you can afford it, if you're a wealthy American, you can have great healthcare. No one's denying that great healthcare doesn't exist in the US. The problem is a lot of people don't have access to it. They can't afford it. That's the problem. So even in the US where there is great healthcare, Americans are going abroad for healthcare. So what does that tell you? Let me go to some of these other quotes. This is just it gets better. I don't know. Quote, don't paint me out to be compassionless. That's exactly what you are. Meghan McCain is compassionless. She has no empathy. There are multiple quotes here. So another one that's very related to this. My perspective changed after my father got sick. First of all, how? Because it doesn't appear that your perspective really changed at all. You don't think people should have health care. But this shows you how broken her mind is. She is only able to at least attempt to empathize with people not in her position if something happens to her directly. Someone like me, I don't need a family member to get really sick and be in the hospital for me to realize that healthcare is important. But she does. This is often what separates conservatives from liberals or progressives. We have compassion and empathy for people not in our position. We don't have to experience something personally to understand how that might affect somebody. But somebody like Meghan McCain, who is a conservative, she needs that personal experience in order to understand and empathize with people in her position. And add that on top of the fact that she is a 100 millionaire because of her parents. This is somebody who is incredibly privileged and thinks that you aren't deserving of healthcare. That healthcare is not a right for you because she doesn't know what your situation is like. She's never been in your situation. She's always been wealthy. She grew up privileged, grew up wealthy, never had to earn anything. She's on The View only because her mom is a multimillionaire and her dad is a senator. That is the only reason anybody knows who the fuck she is. Last quote here, before I have some other points to make. Quote, I'm realistic about what it costs. No, you're a fucking liar. That study that you even said Bernie Sanders put out, and Bernie Sanders put it out because it shows that it saves $2 trillion. You didn't mention that part. You're a liar. You're not realistic about what it costs because the plans have been out there for years and you are not citing them. You're ignoring them. You're staying in your partisan lane and ignoring any information coming at you that may change your opinion, that may prove you wrong. You're a fucking liar. You're a compassionless fucking liar. Last couple things here I want to mention that she didn't mention, but since we're covering healthcare, I might as well bring them up. So people like talk about, oh, there's rationing. Universal healthcare has rationing because you serve everybody, so you can't, because you can't serve everyone, there's rationing. Guess what? There's rationing in the US. The difference is, in the US, healthcare is rationed to those that can afford it. People like Meghan McCain, who can always afford healthcare, don't have to worry. The way it's rationed in other countries that have universal healthcare is that people that need it most get it. If you are really sick, if you need a surgery that is life or death, you get that surgery immediately. You get helped immediately because healthcare is rationed to those that need it, not to who is the wealthiest, not to who can afford it. Last couple points that I've mentioned before, but it's important to point out. 45,000 Americans a year die due to a lack of access to healthcare. That number in Canada, 0. Medical bankruptcies are the most common type of bankruptcy in the US. Medical bankruptcies in Canada or any country with universal healthcare, 0. So, what does that tell you? Meghan McCain only has the perspective of a privileged, rich little brat. She has no idea what most people actually have to deal with. She's never had an issue with money her entire life because she inherited all the money she'll ever need. So yes, once again, Meghan McCain, you are compassionless, stupid, and you disgust me.